Hi, we're here with Carol today, who's getting ready to start with her neuromuscular treatment. So, Carol, before we actually get started, we like to get information from the patient as to their current condition, a little bit of history behind it, and what you expect to have happen with our neuromuscular treatment. So I'm going to leave the floor to you. So feel free, in just a couple of minutes here, that you can tell us your history of your symptoms.
Okay. I've been suffering from migraine headaches for 30 years. I never associated my jaw with my headaches. But the last couple months, I've had a lot of tightness in my jaw. I could barely open it at times, pain in my jaw, and in the middle of the night, my neck feels like it's going to crack off, and it instantly sets off a migraine. And I've also had the feeling of water in my ear, and I thought it was water. I was getting all this these drops and all, trying to get the water out, but obviously it wasn't. I went to a nose, ear, and throat doctor, and they said my sinuses were clear, and there's no indication that there's anything wrong with my ear either.
Okay.
I had an MRI of my sinuses, and they were right. They were clear. The neck pain, I know I have arthritis in my neck, but I went to an orthopedic doctor, and he said that I did have the arthritis, but he can't see why I'm, getting the headaches. So that's really why I came here, because my jaw was an indication there was something wrong. It was tight. I couldn't open it. The headaches, I have pain in my jaw.
Okay. How often are you suffering with your headaches currently?
Well, for a while, I was getting migraines every day.
Every day.
When this really got bad over the last couple months.
Okay.
Waking up in the middle of the night, so I can't sleep.
Right.
So, but the last week or two, I've had headaches, but they weren't as extreme. So I don't know what changed. Maybe my jaw shifted a little more. I don't really know. So that's basically it. The headaches, the ear.
All right. And you feel somewhat, quality of life has been affected because of this at all?
Absolutely.
Yeah.
I'm really so tired, and, I have a headache, and so I'm taking migraine medication all the time.
Right.
Yeah, so,
okay.
when I have the migraines,
it's debilitating.
debilitated.
Right.
Yeah.
Okay. Well, thank you for a little bit of insight as to your current condition, and we'll get you back on camera again later on, obviously, when we get you healthy. So, looking forward to it, and we'll get started now.
Okay.
All right. Okay, we're here with Carol again after about 3 weeks worth of her new orthotic and a new jaw position. Carol, in your own words, can you tell us where you were and where you are now and how much it's improved your life?
Okay. Prior to me coming here, which was, like you said, 3.5 weeks ago, I was experiencing headaches every day. I'd wake up with excruciating pain in my neck and my jaw and my head. And I was having difficulty opening my mouth. My opening was getting less and less, so I started getting a little nervous. So that's when I came here, and you made my orthotic, and I've been wearing it for 3.5 weeks, and I have noticed that, at least my husband's told me, that I snore less. I'm having less pain in my face, and my headaches are practically gone. So I think I'm doing pretty good.
Good. And you said you had headaches for about 30 years now, right?
Yes.
That you were dealing with, obviously, with a neurologist and ENTs.
Yes.
And on medications when you do get them, but it's taken this long for you to realize, hey, you can get a quality of life back that you probably didn't realize you had for all these years. Yeah.
That's true. I have experienced headaches for 30 years. I don't know if all my headaches were related to my jaw, but towards the end, I was, over the last 10 years, I've been suffering less with headaches, but then it started to get bad again. So I think the later headaches definitely were contributed to the jaw.
Okay.
So, but who knows? Maybe it was 30 years I've been suffering with jaw problems and didn't realize it, but I am doing much better.
Good.
So.
All right. Well, great. Well, I appreciate you taking a few moments here to give us your results, and we're glad that you're on a track to good health.
Thank you.
You're welcome.